My name is Rebecca DePatri. I'm one of the oncology nurse navigators here at Peterson Life with Cancer, and I welcome you tonight to our another event in our women's sexual health series here at Peterson Life with Cancer. Um, I've been here at Life with Cancer supporting women in sexual health needs for 8 years. I'm physically located at Fairfax Hospital, but do a lot of programming within Life with Cancer to support our mission of supporting all of you out there. Before we get started, I'd just like to introduce you to a little bit of information about our program here. First of all, I want to say thank you. We're so grateful to the Cancer Action Coalition of Virginia and the Centers for Disease Control and Prevention for awarding us the grant that supports our programming here tonight and the whole series. And as we look ahead, this is session number 3 here. We have sessions almost every other week for the next couple of months, but as you can see, there's a lot of really exciting topics we're going to cover with really some national experts that we are so lucky to be able to present to us. You can take a look here. This is also on our website, and then looking out to the next couple of months about some different types of programs that are available to you. Just going to talk a little bit about Inovichar cancer and the Peterson Life with Cancer. I know many of you are here in the DC area, but a lot of you are joining our program nationally. So the Inovichar Cancer Center is here in Northern Virginia. We support individuals impacted by cancer throughout the whole district, Maryland and Virginia. The Peterson Life with Cancer is part of our integrated system here. The mission of our organization is providing that education and psychosocial support to anybody impacted by cancer, from diagnosis through survivorship. All our programs are evidence-based, and we offer holistic care and programming at no cost, no matter where an individual's cancer treatment is received. Again, focusing on our mission, we offer lots of different groups, support programs, educational programs, mindfulness programs, fitness, and a lot of other different types of offerings. Specifically to sexual health programming, in addition to this series, we offer a women's sexual health support group called Get Your Groove Back. We have movement classes for pelvic floor, and on a regular basis, we have different programs opening up. A lot of them are available online here, and we also have things available in person too. So just continue to check out our website and see what's coming up. We are so lucky to have the support at Inova here, to have our Inovichar specialty shop. They offer a variety of products that support cancer treatment and survivorship experience. In addition to these offerings listed here, we have dilators, we have lubricants, moisturizers at the shop, and things can be ordered directly from the shop to your home if that's what you prefer. But just know that that's available. You can reach out if there's anything that you're interested in or would like to get more information. Just a couple of logistics for tonight. Since this is a webinar format, there's not an opportunity to come on microphone. Lauren will present to us tonight. Feel free to put questions in the Q&A feature, in the chat, whatever you're comfortable with, and we'll address them at the end of the presentation. It's really helpful, since we have many people registered, if you know how and if you're able to rename yourself, so I can match up who's registered to who came tonight. We use that information to send you out a survey of the program and any additional resources that we might want to send out as well. And I just want to have this information here. I'm not going to read it to you, but a quick note that the information presented today is for informational, educational purposes only and should not be treated as medical advice. During this session, if you put something in the Q&A box, again, we'll address it at the end. And we always encourage you, if you're gaining information here or have questions, to bring it back to your healthcare provider. Okay. And we are so lucky tonight to have the expertise of Lauren Trosch. Lauren is a pelvic floor therapist here in the DC metro region. I've had the awesome privilege to be able to work alongside her here at Inova when we were building a lot of programming, and she's been so open to supporting sexual health needs of individuals with cancer. She has over a decade of experience as a physical therapist, specializing in the pelvic floor. She's worked with many patients diagnosed with cancer, and she really helps people who struggle with urinary incontinence, painful sex, a variety of pelvic floor issues, with the goal of keeping them active and healthy. Because of her expertise and her strength in the pelvic floor and an orthopedic physical therapy background, it helps her treat the entire person in clinical practice. Uh, Really important is Lauren is a member of the American Physical Therapies Association Academy of Pelvic Health and is really involved in their volunteer program. She helps lead the DC, Maryland, and Virginia Journal Club, where they discuss the latest research on pelvic floor problems, and she lectures and assists in pelvic floor education online and in the community. And until you need to know a pelvic floor therapist, I don't think anyone realizes what a treasure this is and how important that expertise is. So I turn this over to Lauren, and thank you for being here.
Yeah, it's great to be here. So I am just going to jump right in. I'm glad that we have a nice small group because that'll leave a lot of room of questions and answers, and hopefully we can make sure we're covering all the information that you guys want to hear. I know that the topic of pelvic health is really big, and I wanted to focus in mostly on like a few specific topics, but we can always be sort of flexible depending on what the group is interested in. So let me work on sharing my screen. And of course, if there are any issues, please let me know. So let me just get into presentation. And then we can jump right in. So what I'm going to be talking about today is pelvic floor physical therapy after cancer. And thank you for that nice introduction. Thank you for having me here. And I love kind of working with Life with Cancer. I think it is so nice and rewarding. So this is the same disclaimer that was just said, that none of this is medical advice. And we'll just jump right into it. So the objectives that I have for today's presentation is to, number one, briefly discuss how cancer treatment might impact your pelvic health and, of course, your sexual health. Then understand how changes of the vulvovaginal pelvic floor area may impact your sexual function. And lastly, what people are usually most interested in these presentations is learn some things that you might be able to do to feel better. So, like I just said, we're going to briefly discuss some of the treatments that may have an impact on your pelvic health. Now, there are so many different types of treatments, so many different types of surgeries, medications out there that we won't have the time to discuss all of them. So, we're just going to do a really, really brief overview that just kind of barely touches the surface. So, of course, if you have surgery to an area that you use for your sexual function, this might have an impact on your sexual health. So, there's a lot of different types of surgeries out there. So, like I just said, if you have a change in the tissues that are directly involved in sexual function, then that might have an impact on your sexual function. For example, if your breasts are a big part of your sexual function and you have surgery there, that might kind of change what you're doing sexually. Or if you had surgery to the area of the vagina or the vulva, all of this might involve some changes or kind of some differences in what you might be doing sexually before and after surgery. Oftentimes, what we see in clinic is sometimes fear of using certain body parts after treatment. And we'll also see kind of changes in each person's body image. And of course, how you feel about yourself and how you feel about your body can have an impact on your sexual function, on your libido, on your sexual desire. If you have surgery, let's say to your ovaries, that can have a big impact on your hormones, which can have an impact on the tissues of your vulva and of your vagina. And it can also have a number of wide-ranging impacts on your sexual health. Medications, just like we discussed with surgery, you know, a fair amount of medications might have an impact on your hormones, which, like I just said, which can have an impact on the tissues of the vagina, on the vulva, and have an impact on your sexual health. And of course, with medications, there's not just, side effects that impact your pelvic health, but, potentially you might be experiencing some generalized pain or changes in sensations, changes in your thought processes, all these kinds of things that could have an impact on your sexual health. Radiation, a lot of what we're seeing in the clinic, specific with, different types of pelvic radiation, is that this can lead to changes in tissues. What we'll see a lot of is, people who are coming in with regard to changes in the tissues of the vagina and their vulva, potentially narrowing of the vagina or decrease, length or elasticity of the tissues of the vagina. And sometimes we'll see some things a little bit outside of pelvic health, but can have an impact on your pelvic health, including bowel and bladder changes. So that is the very, very, very brief overview of some of the treatments that can have an impact on your sexual health. So, what can we do? Which is why people are coming into physical therapy. So if you're coming into physical therapy, or if you're even trying to figure out, what's going on with your own sexual health, an important thing or an important place to start is finding out exactly what's contributing to your sexual health concerns, so we can figure out specifically what we might want to do to help. So, I am a physical therapist, a pelvic floor physical therapist, and of course, sexual function is very complex, and there's many biological, psychological, and social influences on our sexual health. As a pelvic floor physical therapist, I'm going to focus mostly on the tissues of the pelvic region and their impacts on pelvic health. And this doesn't mean that kind of pelvic health is more important than all of those other concerns, but it's just what I'm going to focus on mostly today because that's my area of knowledge and expertise. But many of our best treatments for, our pelvic pain, which we're going to discuss a lot about today, and sexual health, often involves multidisciplinary care, often between PT, medical, behavioral health, and also a number of other professionals that can give us some assistance. But as I said before, we're going to focus mostly on the pelvic floor piece because that is what I know best. So what I wanted to talk about, or how I wanted to organize this presentation, is, by what I'm seeing most commonly in the clinic with regard to sexual health concerns after cancer treatment. So I would say the biggest thing that I see, and kind of what I wanted to, oh, and this is spelled wrong, pelvic pain, but this should be pelvic pain limiting sexual function. So I would see this is kind of a huge topic, and we are seeing this often in the clinic, and it's where I wanted to focus our discussion on today. So where we're going to start. So I wanted to do is start from the outside and then work our way in. So in talking about pelvic pain, I wanted to start here at the vulva. And so this is the external genitalia. So we've got some nice kind of cartoon images here. So this is where I wanted to start discussing. So we'll start outside at the vulva, and then we can make our way in towards the pelvic floor. So this is just a little PSA, is that the vulva is not the same thing as the vagina. This image here on the right is an image of a vulva, all of the external genitalia, and this arrow right here is pointing internally to the tissues of the vagina. So if you're watching TV, if you're watching movies, usually anytime they're looking at the vulva, they're always calling it the vagina, but there is a difference between the vulva and then the internal vagina here. So right now we're going to start talking about the vulva, but we'll move in and start talking about the vagina soon enough. So don't worry. So we're going to start with really brief anatomy. So this here is a cartoon image of the vulva. Like we talked about, it's all of the external genitalia. So everything on the outside here, right above here would be that cushy area above your pubic bone, which is known as the mons, everything in between down to below the opening of the vagina to the perineum, which is that space that's between the vagina or between the opening of the vagina and the anus. So one area that I particularly wanted to focus on, I don't know if you guys can see my arrow or not, but this area here. So these inner lips are known as the labia minora. So sort of everything within the labia minora, including right here, the opening of the urethra and the opening of the vagina, this is known as the vestibule. And this is really important because irritation or discomfort really specifically at the opening of the vagina, at the vestibule, is one of the most common things that we see for people who are having discomfort that is limiting their sexual function. So the vestibule. So I tried to zoom in right here. Like I said, it's one of the most common places where we see people having discomfort that is limiting their sexual function. And it is particularly sensitive to hormonal changes. So this is why oftentimes it's coming up with our patients who have are having or have had cancer treatments, because a lot of the treatments that we had discussed can have an impact on your hormones. So this is just a brief little, I guess, education about pain at the vestibule. So the medical term for pain at the vestibule is vestibulodynia. Dynia just means pain. So whenever you see something that has dynia at the end, it just means pain of that particular area. So in the clinic, we see people at, all stages of the lifespan who are coming in with pain at the opening of the vagina. Some people have always had this pain, and they've noticed it from the first time potentially that they've tried to insert in a tampon or tried to have a gynecological exam, that they've noticed some discomfort that could potentially limit their ability to use tampons or even have vaginal exams. So we've got these people who have always had this discomfort their whole life. And then we have some people who come in who have experienced, quite a long time or some years where they have had, relatively minimal to no discomfort with, gynecological exams, tampon use, any type of penetration. But then something happens. Perhaps they've gone through some trauma, some surgery, hormonal changes. Even a history of repeated infections can sometimes contribute to this discomfort at the entrance of the vagina. So what people might say that they're feeling is they might notice a pain, a tightness, a burning, stinging, specifically at the entrance of the vagina, and they might notice it with any type of touching or initial penetration. They also might notice some discomfort with sitting, tight clothing, or some discomfort after urination. In this little cartoon image right here, we have the opening of the vagina. We have the labia minora, those kind of smaller lips. And then you've got here the labia majora, which are the hair-bearing labia. So we're talking about everything here within the labia minora. And you can see right here is the opening of the urethra. So if that area is particularly sensitive, like I said, we might notice people having some irritation after urination. So the big question is always, what can we do? And like I said before, in order for us to figure out exactly what we should be doing, we need to figure out what's contributing to the discomfort that you may be having. So, for example, if you've recently had a hormonal change, either due to going through perimenopause, menopause, a medication that has changed your hormones, or perhaps a surgery that's changed your hormones, what you might notice is kind of some irritation of those superficial tissues, a feeling of dryness, stinging, burning. Maybe it just feels like those tissues aren't super stretchy anymore. It almost feels like instead of stretching, they might tear. So in that case, when we're feeling like it's really sort of a superficial tissue issue, we really want to treat those tissues. And, we might start with a vaginal moisturizer or a lubricant, which we're going to talk about in the next slides. There are also some physicians out there who might prescribe some hormonal medications if that is appropriate for you. But we're not going to talk about any type of medications in this presentation just because it's outside the scope of PT practice, and that would be a great conversation to have with a physician. So it might not be it might not be hormonal changes. It might not be irritation to those superficial tissues, which may be contributing to your symptoms. Maybe we have another person who recently had, surgery to their pelvic area, no changes to their hormones, but maybe they are noticing a lot of muscle tension after surgery. Maybe they haven't even had surgery. Maybe they're just undergoing a lot of stress. They're feeling a lot of tension. And that might be decreasing blood flow to the muscles of the pelvic floor, to the tissues at the entrance of the vagina, and that might be contributing to some irritation. In that case, we might need to deal with kind of muscle relaxation, working with some of those pelvic floor tissues, and we're going to be talking about that in the future as well. So I'm trying to explain that if somebody's having pain in a certain area, we really want to figure out why, and that might lead to the best sort of solution. So like I said, one thing that we want to talk about is vaginal moisturizers and lubricants. So we need to make sure that those tissues at the entrance of the vagina and even within the vagina as well are feeling better, healthier, more elastic, more lubricated in order for symptoms to start feeling better. So I think vaginal moisturizers and also using lubricants can be a great place to start. You might need a little more help than that. It's not a magic bullet that always fixes everything, but for a lot of people, these can be very helpful. So I think a lot of people, and maybe you guys know a lot about vaginal moisturizers, but I think there can be some confusion about vaginal moisturizers and lubricants and what's the difference and when you should be using them and what type and how often you should be using them. So I will compare vaginal moisturizers to any other type of moisturizer that you might be using on your skin. Obviously, the vaginal moisturizers are different in that they are made or designed to be compatible with the tissues of your vagina and the vulva. But just like I might put lotion on my skin every day or every couple of days to keep it from getting dry, maybe I put it in the morning before I go to bed, you would use a vaginal moisturizer in the same type of way. And you can use it anywhere where you're feeling irritation. That's specifically, a vaginal moisturizer that is designed for that area. So as we discussed, that opening of the vagina, that entrance of the vagina might be an area where you're feeling the most irritation. So when you're using, a moisturizer, don't be nervous about gently making sure, comfortably, everything that we're talking about, today in this presentation should be comfortable, but comfortably applying it to all the areas where you're having some irritation. Now, there are a lot of different types of vaginal moisturizers out there. You can see here in this picture on the left that they can come in suppository form. So those you can just kind of pop in internally. They'll melt. Usually with these, I recommend people do them before bed, just to make sure it's not all just kind of coming out and getting on your inner thighs or sort of popping out due to gravity. So you have suppositories here. You also have creams. So some of them will just kind of come in a tube with a cream. Some of them will come with an applicator. So you can use whichever ones feels best for you. Like I said up here, we want to make sure you're getting the vaginal moisturizer in all the areas that you're having irritation. So for some of my people who are using suppositories, and I'll say, put the suppository in, let it melt. And once it's melted, you can use your finger to sort of gently apply it to the entrance of the vagina if you're having some irritation there. You do have ones, and with creams, you can place it externally, you can place it internally, you can use an applicator if you feel comfortable, you can use your finger if you feel comfortable. It's really what works best for you and what your tissues need. So that's the different types. They also are made of different ingredients. So some are water-based. This one over here, I'm guessing, looks like it would be oil-based, but you have water-based ones. Probably the most common one we see at like a CVS or something like that is Replens, which usually comes with an applicator. It works for some people. It irritates the tissues of other people. So sometimes you kind of have to experiment to see what works best for you. You have oil-based ones. So like I said, this probably looks like to me that it's at least bound with oil. Or some people will even use coconut oil just to their tissues. For many people, that works really well. Some people are a bit sensitive to coconut oil, and there's sort of like mixed information out there if coconut oil could potentially increase your risk of yeast infections. So my people who have history of yeast infections sometimes avoid the coconut oil because they're a little bit nervous, but I have plenty of people who use it and it's just fine. You have really nice ones out there, vaginal moisturizers out there that have hyaluronic acid in them. I don't know who out there is using hyaluronic acid for your face, but it's also a great moisturizer for the tissues of the vulva and the vagina. These just tend to be a little bit pricier, but often you don't have to use them, if you follow their instructions, don't have to use them, every day. So there's a lot of different options out there, and sometimes it takes some experimenting to figure out sort of what works best. But everything that you use should be comfortable. Sometimes initially when people start using it, it might feel a little bit stingy, which sometimes it just kind of takes some time for those tissues to get moisturized. But if you find, excuse me, that you keep using it and it's feeling stingy, there might be an ingredient in there that just isn't agreeing with you. So as I discussed, vaginal moisturizers are one thing, and then lubricants are a different thing. So whereas you're going to put your vaginal moisturizer on maybe every night or every 3 nights, depending on the directions that are provided, a lubricant you're using specifically in times where there might be friction. So if you are using dilators, which we're going to discuss, you're probably going to use a lubricant with that. If, during a GYN exam, your GYN is probably using a lubricant with the speculum or with your fingers before they insert. That's what we also do during pelvic floor physical therapy. We're always using lubricants. If your practice or if intercourse is part of your, sexual menu, using that during intercourse is something that you can do. And again, just like the vaginal moisturizers, you can get ones that are water-based. You can get ones that are oil-based. You can get ones that are silicone. So water-based tends to agree with everyone. This is typically, what we're using in the clinic with most of our patients. I know a big popular one that we use in the clinic is called Slippery Stuff. It tends to agree with everyone. There are some water-based lubricants out there that have ingredients that don't agree with some people that actually make things feel a little bit drier. So you also want to make sure you're using a lubricant that works for you. If you are using an oil-based lubricant or even an oil-based vaginal moisturizer, just know that it might not be compatible with condoms, and that should be something that you consider to make sure that that is not a problem. And there are silicone ones too. There's a lot of great silicone lubricants out there as well. These will last a little bit longer. They feel a little bit different than a water-based lubricant. So again, sometimes it takes a little bit of experimentation to find out what's going to work best for you to decrease the friction to those tissues and make things feel as comfortable as possible. So now we're going to move a little bit deeper. So like I said, we were kind of starting at the entrance, and then we're going to make our way in to the pelvic floor and discuss some of these pelvic floor muscles. Now that we're done kind of talking about treating some of those more superficial tissues. So what exactly is the pelvic floor? So I'm going to try to keep my anatomy lesson nice and short and sweet. So the pelvic floor, it's a group of muscles and connective tissues that are between your legs, and they help to control what comes in and out of your pelvis. So in order for something to go into your pelvis, let's say for a GYN exam, or if you're interested in any type of, penetration, Those muscles of the pelvic floor, they need to relax so that something can get into your pelvis. Also, in order to let something out of your pelvis, let's say if you want to urinate or have a bowel movement, to urinate, those muscles around the urethra, they need to relax. In order to have a bowel movement, those muscles at the opening of the anus, that external anal sphincter needs to stretch open a little bit so that you can have a bowel movement. So we want to make sure that, the muscles of the pelvic floor, everything is functioning well so we can keep in what we want to keep in. We don't want to be having urinary incontinence or fecal incontinence or accidental gas loss. And we want things to relax to allow things out of our pelvis and into the pelvis as well. So here are just a few different views of the pelvic floor. So we're going to start over here. This is the view from below, someone lying on their back. This is a nice view. You can see some of these superficial muscles that go around the opening of the urethra, the opening of the vagina, and the opening of the anus. So like we discussed, in order to have a bowel movement, these muscles need to stretch open a little bit. The muscles around the vagina need to relax if you want to allow anything into the pelvis, and the muscles around the urethra need to relax as well in order to urinate. This is a side view of the pelvic floor in the middle right here. So you can see there's a pubic bone in the front. You can see the clitoris here, but here's the urethra and the bladder. It's all yellow and I guess filled with urine, so we know what we're looking at. Here is the vagina right here, and here is the anal canal, rectum. So you can see here the pelvic floor is supporting the bottom portions of the pelvic organs. And then here is just a view looking down. And you can see how these pelvic floor muscles really act like a supportive hammock, supporting the bottom parts of the pelvic organs. So like I said, it's important to have well-functioning pelvic floor muscles to sort of keep us dry, incontinent, allow us to pee, allow us to poop, allow things to come in and out of our pelvis, allow for comfortable touch of the genital areas. So if things are potentially too tight or overactive, that can lead to some functional issues. And also, if you're having some weakness of these pelvic floor muscles, that might also, or lack of coordination, this might lead to some functional issues as well. Now, when it comes to difficulties with sexual function, a lot of the things that I'm seeing in the clinic is this pelvic floor muscle overactivity, this tension that might be leading to some problems with sexual function. So this is what we're going to focus on most today as compared to some of the weakness. So if I asked you all to make a tight fist and to hold it for the next 10 minutes of this presentation and hold it tight and not move it, you might notice that, if you take a look at your hand, that it might be coming red in certain places, that other areas might be coming like a little bit more pale due to decreased blood flow. After some time, maybe your fingers start to feel a little bit sore. Maybe the soreness or burning starts to spread as you're getting less blood flow to these tissues due to this kind of muscle tension. And then if I asked you to try to open your hand, at first, I only held that for a couple of seconds, it would be difficult and painful to move. So I like to use this analogy that if we're kind of holding muscles tight for long periods of time, it can lead to decreased blood flow to those tissues and pain. And when that's kind of happening in your pelvic floor area, that can lead to limitations in your sexual function. So, and that can contribute to discomfort superficially. If we saw back here in these little models, we do have these superficial muscles of the pelvic floor. They're not as superficial as the tissues of the vulva, but they're sort of right behind that. That can lead to some discomfort superficially, or it can lead to some discomfort deeper within the pelvis. So, which of course can have impacts on your sexual health for some people. So, we were just kind of talking about sort of generalized tension that could be leading to discomfort and have an impact on your sexual function. What I want to talk about now is sort of the involuntary contraction of pelvic floor muscles, oftentimes in response to touch or penetration, that can make penetration or touch to that area painful, or it can potentially block penetration and make it impossible. And this term, that kind of for an involuntary contraction of the pelvic floor muscles, is known as vaginismus. So there was a really interesting study that was done quite some time ago. So this is an old study, but the subjects in this study, they had them watch, I guess, different scenes, some of them which were scary, and they were measuring the muscle activity in different muscles. And what they found is that the pelvic floor muscles were the first muscles to contract in response to threat. So those muscles tightening up in response to threat is not an abnormal thing. The issue with vaginismus is those muscles are sort of tensing up and kind of staying contracted to the point where it's painful. It's almost like your protective mechanism is working a bit too well and leading to some discomfort. So, what can we do about either general tightness, overactivity of the pelvic floor muscles, or vaginismus? And you can see from this picture here that there are a bunch of things that we can do. Um, and what we kind of do or what you do, will depend on your specific needs. So we have a lot of different tools because different things work for different people. Now, I think you guys last week had to talk about yoga. And we do have some evidence that yoga and stretching to the pelvic floor can be helpful, but we won't go too much into that since you've already had some information about that in the past. One thing that I wanted to make sure that we talked about, and sorry again, there's a little misspelling here, were vaginal dilators. Now, some people refer to these as vaginal trainers, but I think most people know them as vaginal dilators. So what are they? So here's a photo right here. This is kind of a larger set. They come much smaller. But vaginal, dilators are used to progressively stretch the tissues of the vagina, the entrance of the vagina, and the pelvic floor muscles. They're recommended to a lot of different patients, but they're oftentimes recommended after radiation to help stretch the tissues of the vagina. So with dilators, I think there can be a lot of confusion how to use them, and that is totally normal. But using dilators should be relatively comfortable. If you did get a set of dilators, and just like lubricants and moisturizers, there's so many different types of dilators out there. There's silicone ones, there's plastic ones, there's ones that vibrate. You really want to get ones that feel comfortable for you, and you want to start at the size that feels comfortable for you. You want to be able to gently insert the dilator. And if something feels tense or uncomfortable, we don't want you to sort of force your way through tense muscles. What we want you to do is wait, relax, maybe massage the tissues a little bit. You might need to move the dilator around a little bit, see if your tissues relax, and then see if you're able to progress the dilator further. Now, if you do feel like you need help with this process, and the idea would be you would kind of progress in sizes. As you can see, they start kind of small and they can get bigger. So if you're having any difficulty or pain with a dilator program, this process does take time, and you might need some guidance from a professional on how to use them and what might work best for you. But it should be relatively comfortable. It shouldn't be super painful or any of those sorts of things. So, like we said, they can be used to kind of gently stretch the muscles of the pelvic floor, the tissues at the entrance of the vagina. They're also interesting as well, because we talked about that diagnosis, vaginismus, which is that kind of pelvic floor muscle contraction in response to touch or penetration. So when we use things that are kind of comfortable with penetration, so if you're using a smaller dilator, you're able to insert it vaginally, that kind of teaches your system that penetration isn't necessarily a threat and something to protect against. So, on top of sort of stretching the tissues, they can be a really nice retraining tool to gradually re educate your muscles and your tissues that penetration or touch to the tissues is not necessarily a threat to contract and protect against. And they can also be used to gently stretch and massage the muscles of the pelvic floor. So you don't necessarily just need to kind of put them in and let them sit there. You can use them to gently massage the pelvic floor muscles. And dilators are not the only tools out there. I think there's some of the, better known tools. Um, but if kind of stretching the tissues of the pelvic floor or the pelvic floor muscles is the right treatment for you, and dilators might not be the best treatment for you. Maybe you've tried them, they haven't worked. There are other tools that you can use to gently stretch those tissues. You can see here, this is a wand that's designed to massage the pelvic floor muscles. Um, you can also use your own finger to stretch the muscles of the pelvic floor, your finger, your thumb. Some people, instead of using, clinical medical dilators, they like to use, their own vibrators that they have, and you can get them in all sorts of sizes, different materials as well to kind of gently stretch some of those tissues. It is really about finding the tools that work best for you. And if all of this feels a little bit overwhelming and you feel like kind of massage or treatment to those pelvic floor muscles or manual treatment might be helpful, do not be afraid to ask for guidance and help. For many people, using these tools or massaging those pelvic floor muscles is not necessarily intuitive. And if you need some help or support, that is totally normal. And just to talk about different tools out there, this is another one out there. I think it's actually maybe called something like a little bit different now. But as you can see here, these are some silicone rings, which you can use 1, 2, 3. And if you are interested in, using a toy for penetration, or if any type of penetration is part of your sexual practice, you can use these rings to kind of continue to participate in penetration, but it decreases the depth of penetration. So if really deep penetration is something that's not comfortable for you, there are tools to help with that as well, if that's part of your sexual menu. So, as I said, they're manual stretching or kind of dilators. That's one sort of tool to treat pelvic pain or pelvic floor muscle overactivity. There's also other treatments as well. These might involve stretching, exercise, slow deep breathing, yoga, meditation. You can see she's getting like a really nice stretch to her pelvic floor here. I know that we just had a talk on yoga, so I don't want to get too much into it. But there's a lot of different stretches to kind of open up the pelvic floor, cat camel to really get that pelvis moving. I love using different, therapy balls in order to get the pelvis moving, because if you're really moving that pelvis well, we know that it's less likely that you're sort of having, any type of clenching to those pelvic floor muscles. Again, I do not want to get too much into the yoga, but these are just different examples of poses or stretches that can nicely stretch the pelvic floor, like a child's pose, a low squat, lotus pose, warrior pose, cat camel, and then off it also here a happy baby. Not all of these stretches work for every person, and you've got to find what works well with your body. But these are just examples of common stretches that people will use to help with pelvic or muscle tightness or overactivity. Of course, I'm a physical therapist, so I want to encourage general exercise as well. It can be anti-inflammatory in nature. It can help with sort of general muscle health, can help with depression, anxiety, like I said, improve tissue health. So that can be a nice also supplement to your treatment. And, as I'm kind of wrapping up with some of my content, because like I said, I wanted to focus on really pelvic pain, because that's what, we tend to see as one of our biggest limitations of sexual function. You know, I feel like you can't get through a whole pelvic floor presentation and not talk about Kegels at all. Oftentimes, people have a lot of questions about Kegels or pelvic floor muscle training programs. So, and what we like to say, instead of just saying Kegels, we often like to, which a Kegel, let me like take a couple steps back, is that contraction of your pelvic floor muscle. So instead of just referring to pelvic floor muscle exercise as Kegels, we prefer to call it pelvic floor muscle training because, like I said in the beginning, the pelvic floor is very important in controlling what comes in and out of the pelvis. So it's not only important that those muscles are able to contract, that you're able to strengthen those muscles, but it's really important that you're able to relax as well. So a lot of these pelvic floor muscle training programs that we're looking at in the literature and the scientific literature focuses on not only tightening and contraction of the pelvic floor muscles or Kegels, but also focusing on relaxation of those muscles as well. So we have a lot of really good scientific evidence to support pelvic floor muscle trainings to help with urinary incontinence. It's some of our best research that we have out in our field. And we know that urinary health can have an impact on your sexual health, of course. So, some people who have urinary incontinence, this can lead to some anxiety about potentially leaking during intimacy, which can, of course, have an impact on their sexual function. So, I don't think it's necessarily, bad to speak about this during a pelvic, sexual health presentation. I just wanted to make sure that we had enough time to cover, some of our major stuff thoroughly. But if we want to talk a little bit more about pelvic floor muscle training programs, about urinary continence, and we've got time to do so, I would be happy to do so. We also do have some evidence to support pelvic floor muscle training and sexual function. So we don't have a ton of literature on this, but we have seen even in the population of people who do have cancer, there was a study done that showed improvement in sexual function post hysterectomy. And again, my apologies for that misspelling there. So especially I think for our patients who are not having a lot of pelvic floor muscle overactivity, sometimes doing some strengthening can add real benefits to their pelvic health. So I'm not at all saying that, Kegels are bad or pelvic floor muscle training is inappropriate for all people. It definitely, I prescribe pelvic floor muscle training and or Kegels to a lot of my patients. It's just, prescribing, as I've said throughout this whole program, the right types of treatment for, specific different types of problems. So in summary, decreased tissue mobility, muscle tension, dryness, increased sensitivity of tissues after treatment can contribute to pelvic pain. And pelvic health concerns like pelvic pain can have major impacts on sexual health. And there's a lot that can be done to improve tissue health and sexual function. And hopefully we've laid some of those out today. And of course, working with a team of multidisciplinary providers can be quite helpful. So the rest is my references. And if we wanted to talk about urinary incontinence, we can, but I wanted to make sure that, we were able to, with like this nice, good sized group, that we were able to at least look and discuss some of the questions that people have.
Thanks so much, Lauren. That was awesome.
Thank you.
We do have a couple questions in the chat here. One of them that was asked is, are suppositories, do you need a prescription? I had answered that. No, they're over the counter. I don't know if there are any that are prescription based, but
there are some prescriptions out there. We have some people, especially who maybe have that pelvic floor muscle overactivity, that sometimes our physicians, there's all different types of cocktails out there, but we'll maybe prescribe a suppository, like a Valium suppository, or some of them have baclofen in them to sort of relax the muscles. Those you would definitely need a prescription from a physician, and those are sort of more specifically for relaxation of the muscles. There are all different types of internal, estrogen treatments that also would be prescribed by a physician. But what we were talking about in this presentation was just the ones that you can get them, some of them I think you can get at CVS. A lot of the good ones that are more like agreeable with your tissues, people will order them online.
Great, thank you. And I guess that's great because it bridges us to the next um, question we often get asked here. Can we use any vaginal moisturizer or lubricants when dealing with breast cancer estrogen receptive?
Well, all of the ones that we discussed. So, talking about any of those treatments that have estrogen, that's definitely, and like I said, your doctor would need to prescribe that. A conversation that you should have with your physicians. I have to say, there's so like this is kind of like the hot topic of the day. There's a lot of information out there, specifically on estrogen, and there's a lot of resources out there. But everything that we discussed, these are, made of, oil and water-based and silicone, those, I haven't had anybody who has had any problems using them with their physicians. They don't have any estrogen in them. So usually they are safe and recommended. Like I said, you want to make sure the ingredients agree with you, that some of them, like the organic ones, might have like aloe or something in that. And if you're allergic to that, that might not feel great. But finding the ones that work for you. All of these are not prescriptive, so they should be fine regardless of your particular type of what you have going on.
Right, that's really helpful. And I like how you mentioned too that there's so many products on the market. Sometimes it takes trying a couple out, or you can order so many things just on Amazon and CVS through private websites, but seeing what works for you, because there are so many.
Yeah,
I think it confuses a lot of people because
right.
there's so many options.
Right. And you can't order anything with prescriptive medicines over the internet. So you're not going to accidentally order anything that, a physician might have a problem with. But if you do have any questions, please talk to your physician or your medical provider.
Great, thank you. Someone asked, have you heard of sea buckthorn oil or liquid gel pills being helpful for generating vaginal moisture?
I haven't heard of them. Um, what are they called again?
No, I haven't heard of it either. Sea
Okay.
buckthorn oil.
I haven't. I mean, um, so like I said, there's a lot of oil-based moisturizers out there. I think the most common one that we hear of is just coconut oil because it's like cheap and easy. Like I said, it agrees with some people. It doesn't agree with other people. Um, the liquid gel pills, I have had patients, and I don't know if there's like a specific one, but I do think there are like water-based like KY inserts that I've had one patient use before. But I don't have too much experience with those specific types of vaginal moisturizers. That doesn't mean they're, good or bad. I just feel like, like Rebecca said, there's, I feel like, as many types of moisturizers and lubricants out there as there are stars in the sky, which is, oh, good. Somebody loves the KY liquid beads.
And then the
Yeah.
same person who asked the question said, this is a supplement,
Okay.
What she
Oh
meant to say.
yeah, and I have to admit I don't know too much about supplements, and I haven't heard of it before. Doesn't mean it's good or bad. I don't have experience with it.
Great. Okay. And I see people putting in the chat that they love the KY liquid beads. I have pain with deep penetration. What can help?
And that's one of those things with regard to deep penetration. There can be so many different reasons for why somebody is having deep penetration, which it makes it very, difficult to answer sort of specific questions. We see everything from deep penetration, coming from, some tension in those pelvic floor muscles, in which pelvic floor physical therapy might be appropriate. Sometimes we even have discomfort with deep penetration to even like tension or discomfort in the hips. It can be due to like a number of different reasons. So that would be one of those ones. I mean, like I said, there is I think it's called like the ONUT product out there. This doesn't necessarily treat the deep penetration, but there are some things that can limit the depth of penetration to avoid deep penetration and make things like a little bit more comfortable. But this would be one of those examples where it would be a good idea to maybe, see a medical provider, figure out exactly what is contributing, because there's so many different sources or different things that can cause deep penetration. Figure out what's going on so you can make sure you get like the specific treatment or advice you might need.
Great. Rolling down here. I don't know if we'll cover this. What type of moisturizer might you recommend to try and start for a very sensitive person, yeast infection, sensitive skin, etc.?
So yeah, in those cases, potentially like a water-based moisturizer might work well. Specific brands that I can think of. I think it's called Yes or Yes, Yes, Yes. That tends to agree with like a lot of people. So I think water-based might be like a nice place to start. Sometimes organic can be good. For some people, I guess in order to be classified as organic, I think products need to have like a certain number of organic ingredients in them. For example, there's like a brand out there called, Good Clean Love, and they have some products in them that will have aloe, which, like I said, some people are sensitive or allergic to aloe, so that might not be the best. But Good Clean Love also has a vaginal moisturizer out there. I think it has high hyaluronic acid in it that does not have aloe in it. So I would say maybe sticking with something that is water based, like the Yes or the Good Clean Love, but making sure that they don't have aloe or something in it that might irritate you. And I always tell people it's different. The tissues of my arm or even of the labia majora, which are the hair-bearing labia, are very different from the sort of tissues at the vestibule or the vagina. So, you can always make sure to test things out on your skin or just like put a little bit on and see how it feels. So if you're having any irritation, you can just sort of like wash it off quickly. But I would start maybe water-based, playing around there, and seeing if you can find something that works best.
Thank you. And I know since we mentioned hyaluronic acid, someone asked, are there any side effects with hyaluronic acid? And I know you mentioned it's in a lot of our face serums and lotions and moisturizers, but have you had any experience?
I haven't heard of any side effects. I've had all different types of patients use them. I always tell people that everyone's a little bit different. So if you use it and it's not agreeing with you, then, maybe that's not the best product for you. But I'm not so sure if I've heard of any side effects from it. But it wouldn't hurt to kind of, if you're looking at any of them, take a look and make sure there's no sort of disclaimers or warnings on there.
And I often get that question a lot too. Someone else asked in the group here, the suppositories have cocoa butter and beeswax. Do you think it could cause any problems? I ordered them online. Again, I think sort of as you mentioned, there's a lot of different products just to see how you react
Right,
to them.
exactly. So, I know, like, especially because I have a lot of people who really like the suppositories, they're oftentimes bound with some type of oil. So I'll always caution my people, especially if they're kind of putting them in right before, intercourse, to make sure that everything is sort of as smooth as possible. I always caution them this does have oil in it, so maybe this might not be the best thing to use if you're using like a condom that could potentially like break down with oil. Um, so, I mean, yeah, like I said, there's a lot of products out there that have oil in them that can agree with a lot of people. But if you find that they're not agreeing with you, if they're causing any type of, you know, irritation, or if you're noticing infections or anything afterwards, then I wouldn't continue to use them. Now, I mean, I think, Rebecca, I appreciate your experience as well. I always give these disclaimers, and I do have people who kind of play around and choose the ones that are right for them, and people who are really sensitive and have to be really careful about what they're choosing. But for a lot of people, a lot of stuff does end up agreeing with them and being okay. As long as you're buying products that are specifically designed, to go into the vagina and not just picking up like, your hand cream and that sort of stuff.
And that's another question someone mentioned. If I have hyaluronic acid that's used on my face, can I use it on my vagina? I have a painful opening with intercourse.
So, I would recommend using things that are actually sort of designed for that area. I do think I have had a patient who has done that before and hasn't had bad effects, but I would stick to the things that are designed to be compatible with tissues of the vulva and the vagina.
And then I have a couple. These are great questions because we hear this too. They're two of them are sort of related. I'll read them both together. Where can we get pelvic therapy exercises? What kind of doctor do I see? And can you describe what an appointment with a pelvic floor PT is like?
For sure. So, different systems are sort of different. I know, sort of at Inova, in order to see a pelvic floor physical therapist, you do need a prescription from like a nurse practitioner or a physician. So you might need to speak to, a nurse practitioner or a physician in order to get a referral for pelvic floor muscle exercise or pelvic floor muscle training, pelvic floor physical therapy. Many places, I mean, according to different sorts of state laws, Virginia, Maryland, and DC, we do have direct access laws, meaning that you can go to a physical therapist directly, but some clinics, such as the ones at Inova, just have policies that you need to get a prescription from a physician first. And I might have missed something in the middle here. But when it comes to, what kind of happens, especially at the first visit, with a pelvic floor physical therapist. And, it sort of depends on time. So maybe we'll talk about like the first 2 visits or so, because, everything is always going to start with a review of a history and a nice conversation about what you're coming in for and what your goals for physical therapy are. Sort of like if you've been to any other type of physical therapy, that's how it would go. Usually I've always treated in private treatment rooms, so you're not going to be out in the gym talking about these types of things. So first go over like a thorough history. Oftentimes, if there is time, whenever, either during that first or second visit, there would be some type of exam. So oftentimes we like to evaluate the whole person. So this might be like a screen of your systems, looking at your flexibility, your spinal range of motion, your hip mobility. And if you do feel comfortable, we can do a pelvic exam. Different people will also have different tools on how to evaluate the pelvic floor. Some people will use ultrasound, or, which I think most people are familiar with, ultrasound when looking at sonograms and that kind of stuff. We can use similar technology to look at the pelvic floor. Some people will use other types of tools to assess the pelvic floor. We can do a visual exam just to kind of see your ability to sort of squeeze and relax the pelvic floor muscles. And if you do feel comfortable, we can do a pelvic exam where we look at your ability to squeeze, relax, gently stretch those muscles. And if you do feel comfortable, we would feel externally at the tissues of the vulva and the vestibule. And if you do feel comfortable placing either 1 or 2 fingers internally to be able to feel and assess the pelvic floor muscles, assess your strength and your coordination. Now, everyone's going to be a little bit different, But those are some of the things that can be done, but a lot of it will depend on your level of comfort and what you feel comfortable with. 99.999, most of the time, your pelvic floor physical therapist is not going to use a speculum. There's like kind of special cases where a pelvic floor physical therapist might use a half speculum, but this is sort of rare. Usually, if there is any type of internal component, it's going to be just with a finger or two.
Right. I think there's a lot of fear of the unknown when it comes to that. So that's really helpful, I think, for women to hear. Um, and what's kind of doctor, I guess, who might be the individuals? I know you as you have a physical therapy, but who might be those individuals doing the exams? What is the background and experience?
Okay. So, I guess the question is more about us, not like referring physicians or that sort of thing. So it would be us, someone like me who is a pelvic floor physical therapist. So the majority of the pelvic floor physical therapists have their doctorate degrees. So, that means I guess it's like a postgraduate degree after what is it, undergrad? It's about like a 3-year program for physical therapy. Physical therapists come out as generalists. So usually most of the pelvic floor physical therapists that you're seeing have had additional training outside the generalist training. Does that answer the question?
I think so. I think it's sort of that
Okay.
mystery. Who are you? Who
Yeah.
are these special individuals out there? That's great.
Yeah. So
Um,
we're physical therapists just like everyone else. We just have sort of additional training that, teaches us about how to evaluate the pelvic floor and specific knowledge about, bowel, bladder, and sexual function that most of our colleagues don't have.
I know you are a treasure to our patients who need you. Um, I know you briefly talked about this, but how would you go about testing compatibility of your skin? I know you mentioned maybe trying something on the forearm or trying different products if there's a sensitivity. I think that's what the question
Oh, yes.
around.
So yeah, if you're unsure, I think you can obviously if you're gonna have like a reaction on, the skin, then you definitely don't want to put it on the tissues of your, vagina or your vestibule. You can always start by just like taking, if it feels fine on your skin, you can always start, by putting a little bit at the end, just like maybe like a finger pad deep to see how that feels. Because if you start feeling like it's not agreeing with you, then you can wash it off. The tricky thing is, um, sometimes I don't know if you guys have ever had really, really dry skin before. Sometimes the first couple times that you're rubbing in lotion, it can almost feel like a little bit burny. So sometimes it can be hard to distinguish, is this just because you're putting, something on really dry, irritated tissues for the first time? So especially if I have people rubbing, a vaginal moisturizer into the tissues at the entrance of the vagina, I'm, telling them don't massage super deeply. You just want to kind of gently rub into the tissues. And sometimes, even doctors who prescribe creams for that area, they'll say, oh, if it stings a little bit, you're getting it in the right spot. So it can be tricky because sometimes if those tissues are a bit irritated, I'm sure you guys have had this experience on your skin before. Really putting anything on it can be a little uncomfortable. So sometimes it takes a little bit of time to become more comfortable. So sometimes in the beginning, it can be hard to tell, is this just feeling a little stingy because my tissues are a little bit irritated? Um, or is it just, feeling stingy because, I'm allergic to aloe or something like that? So that's the one place it can be a little bit tricky. So if you're trying a bunch of different things and really nothing is agreeing and it's feeling stingy, number one, it's probably good to see a medical provider just to make sure there's nothing else going on. But it might take a little time for those tissues to start feeling better. But I mean, that should be happening pretty quickly. It's not like you should be rubbing in vaginal moisturizer for 3 months and it's still feeling stingy, burning, irritating. And if that is the case, it's good to go to a medical provider just to make sure you're getting what you need for those tissues.
Thank you. Any concerns with intercourse? while or after inserting vaginal moisturizers?
So the one piece, like I said before, because I'll often tell people, it can be almost just like, especially if you have dryness, especially if you're not, sort of creating your own moisturizer like you were before, or if you've never been a person that's really created a lot of moisture with arousal, that type of thing. Sometimes it can be really nice to kind of like a few minutes before pop in a suppository, just to make sure everything is super covered and, that things you're decreasing friction as much as you can. But like I said, a lot of those will be bound in some type of oil. And I believe it's latex condoms, but it would say this, on the condoms, and it says this on the vaginal moisturizers as well, if they're not compatible with condoms. So if you're using condoms, I think you need to be a little bit more careful with either what kind of condoms you're using and any oil-based products. And I think that's why those, which it seems like people are a big fan of here, um, but a lot of people are a big fan of those KY liquid beads because they are water based and you can just kind of pop that in before intercourse. Like, it doesn't have to be like this whole big thing where you're like rubbing in moisturizer before. It can be like, all right, I'm going to go to the bathroom. I'm going to come back. I'm going to pop this in. And by the time that things get going, everything is really nice and moisturized and you've decreased some of that friction.
That's great. I know that practical advice, that sometimes
Hmm.
eases some of this. As someone writes in, I have pain at insertion at the bottom of my vestibule that goes away as we go on with penis and vagina intercourse. Is there any
Hmm.
way to ease this? Is there any safe numbing cream to use?
Um, so yeah, and that bottom part of the vestibule, so that is an area where a lot of those superficial muscles are coming together. And it's, I would say, probably the most common place to have pain with intercourse, and that's something that we hear all the time. Sometimes it'll be pain with that initial insertion. For some people, it persists, but for a lot of people, it goes away. And that's one of those times where I really encourage people when you're using products, make sure that you're really getting it into that area, even like about a knuckle or half a knuckle deep, just to make sure you're really getting those tissues. Because sometimes it's not just at the entrance, but like a little bit beyond that as well. I'm sorry, what was the second part of the question? Oh, about numbing creams.
Right.
Yeah, a lot of times, in the past, I think this was more popular, but people have prescribed different lidocaine treatments, and those are perfectly safe to use. Sometimes they can be a little bit stingy, so that's the only downside of them is that sometimes they can get sorry about that, a little bit stingy afterwards, which I think sometimes will move people away from them, but they're definitely a treatment that have been used quite some time, and that they're not dangerous or anything like that, but they might be a little bit stingy with use afterwards.
Okay. Does being properly moisturized help with urine incontinence?
I would say when it comes to urinary incontinence, I mean, unless if we talked about how that opening, um, of the urethra was part of the vestibule, and all of those tissues of the vestibule are particularly hormonally sensitive. So, with kind of decreased estrogen to those tissues, that area can get more irritated. So, if some of your incontinence was related to tissue irritation, that could potentially help. But I think we have stronger evidence for there's also all different types of urinary incontinence, stress incontinence, that leaking with laughing, sneezing, coughing, or urge incontinence, where you get that strong urgency and are leaking on the way to the bathroom. So we do have definitely stronger evidence for some behavioral training, bladder training, or pelvic floor muscle strengthening for these issues, rather than just sort of vaginal moisturizers. But if irritation was the primary reason you were having incontinence, it could help. But we don't have the most evidence for that.
Great. And I really like how you brought up the idea of pelvic floor muscle training, because so often the only messaging so many women get is just about the Kegel, but it's not about the learning to relax those muscles, which sometimes can really help, I think, in our population. That's it. You have to takes practice to learn how to do that.
Right, exactly. And that's not to say, because I think also in our profession, things have like shifted the other way where people are like, oh, never do Kegels. And that's not the case either. It's like we want sort of that mix in the middle where, we want to make sure we just have like strong, coordinated, healthy, flexible pelvic floor muscles. We want all the things.
Thanks, Lauren. I don't have any other questions in the chat unless anyone has any additional questions. I know someone mentioned the Pelvic Floor People website to go check out the ONUT.
Hmm.
To find a pelvic floor physical therapist, what would you recommend? Certainly we have a list, but going to your national website or for pelvic floor
Right.
therapists, is that what you
So
recommend?
the American Physical Therapy Association, which is all physical therapists, they have what we call our Academy of Pelvic Health. So they're going to have a list of providers, so like all over, the US. It's going to say where providers are. There's also a different continuing education company out there that's called Herman and Wallace. They also have a list of pelvic floor PTs, and then another great list, or another also has a lot of great resources, and a list of PTs is through the Pelvic Guru. So those are some, really nice places. Yeah, the APTA Pelvic Health, PT Locator. Herman and Wallace also has a site, and the Pelvic Guru has some great resources out there. Um, and when it comes to resources, when it comes to all those different tools, and yeah, the pelvic people who have the ONUT, they also have this like wonderful new device called the Kiwi, which is great for some pelvic floor muscle release, massage. And there's also a lot of good resources out there, with this company, Intimate Rose, which sells a lot of dilators, wands. They have nice videos and write-ups. These are the popular ones. I don't have any associations with any of these companies. I don't benefit, but they have a lot of good resources out there. So there's enough tools out there that you can find the right one. But I also understand that sometimes it's too much and it can be a little bit overwhelming how to choose.
Well, thank you so much, Lauren. I really appreciate your time and all the care you provide and offer and just sharing your expertise tonight.